two ends. That two ends actually epiphysis and two epiphysis. But short long bones, they have one diaphysis and one epiphysis, right? They are metacarpal, metatarsal, etc. Diaphysis is shaft. Shaft is called diaphysis. Between two epiphyses, dia means in between. In between two epiphyses, that is called diaphysis, right? Here you see, this end epiphysis, this end epiphysis, intervening, this one is diaphysis, right? It is a growing long bone. Diagram है growing long bones, right? Now come to the short bones. Number 3, after short bones comes, what is the example of short bones? Carpals and tarsals, right? Now flat bones, flat bones, scapula, flat bones, sternum, they are flat bones. If you see the structure of the flat bones, you will see the flat bones, actually it's upper or lower surface or inner and outer surface comprises of compact bone and intervening spongy bone, right? In case of skull, it is also flat bones. Suppose parietal, their outer table, outer surface and inner surface is formed by compact bones and intervening spongy bone. It is also called diploic. Okay, this spongy part is known as diploic, right? Now, after flat bones comes irregular bone. Irregular, this name itself tells irregular shape. As for example, vertebra, irregular bone, right? Now, after that, pneumatic bone. This pneumatic bone contains some air cavity within it. As for example, maxilla. Within maxilla there is a big cavity that is called maxillary air sinus. Another example is sphenoid. Sphenoid also consists of sphenoidal air sinus. So they are pneumatic bones, right? So these are the bones based on shape, right? Based on shape. Another important bone which generally comes as a short note, sesamoid bone. Sesamoid bone, actually I will write down on the board which is important from your examination point of view. Sesamoid bone. Sesamoid, this word has come from sesame. Sesame means seed. As this bone looks like a seed, so this is called sesamoid bone. Its characteristic is it develops within a tendon of a muscle. The biggest sesamoid bone is patella. Here you see, this is the patella. This patella develops within the tendon of quadriceps femoris muscle. This muscle at the front of the thigh, this muscle is known as quadriceps. Within its tendon develop patella. And there is another important, there are so many sesamoid bones, I am just mentioning 3 or 4. Another important sesamoid bone is pisiform. It is found at the wrist region. It develops within the tendon of flexor carpi ulnaris muscle. Sesamoid develop within the pisiform. Flexor carpi ulnaris. Right. There is another bone that is called riders. Here it is the second, first is patella. Patella. It develops within the tendon of quadriceps femoris. Quadriceps femoris. Number 3, riders bone. Riders. It develops within the tendon of the adductor longus muscle. That muscle is found at the adductor compartment of thigh. Adductor compartment of thigh, that is called adductor longus muscle, where it is taking origin as a tendon. Within this tendon, this pisiform bone develops. It is known as riders. Why it is called riders? Riders. Adductor longus. Those people who generally ride horse riders, what they do to prevent their falling, they tightly catches the horse by adducting the thigh. So it is adductor muscle. So that muscle will be stretched, and continuous stretching actually stimulates the formation of this bone. That's why it is called rider's bone, right? So these are few examples. Now main characteristics is this bone has got no periosteum. This bone has got no periosteum. Every bone is covered by outer covering, that is called periosteum. This bone has got no periosteum, right? Number 1 is no periosteum. Actually, I will leave you 10 minutes before. I shall have to go to university for checking your seniors' answer script. That's why 10 minutes before I will go. Number 1, devoid of periosteum, or no periosteum. Number 2, no Haversian system. I will talk it later on. No Haversian system. It has got no independent blood supply. It has got no independent blood supply. Right. So it has got no periosteum, no Haversian system. What? Haversian system. I will talk it when I will discuss the structure of the bone. Then we will come to know what is Haversian system, right? Then from where it gets its supply? It has no independent blood supply. So from where it gets its nutrition? Actually, from the tendon of which muscle is develops, from blood supply of that muscle will supply it. Clear? Suppose flexor carpi ulnaris, the artery which is supplying flexor carpi ulnaris will also supply. Another point is it has no primary ossification center. I will come to ossification center later on. No primary center of ossification. Now, what is the function of this sesamoid bone? What is the function? Actually, it is generally found where there is a chance of friction between the tendon of the muscle and underlying bone. If there is any chance of friction, actually at that places these sesamoid bone develops, and that portion which is subject to friction, that part is covered by cartilage, hyaline cartilage, right? It also alters the direction of the muscle pull. How? Suppose there is a muscle like this. That muscle here there is a sesamoid bone, and that muscle is inserting here, right? So, if this muscle contracts, then it will like this because of the presence of this sesamoid bone. So it has this muscle will contracting. It is pulling like this, but there is alteration of the direction, right? So sometimes it alters the direction of the muscle pull because of the presence of the sesamoid bone, right? So these are the few points of the sesamoid bone. If it comes as a short note, you also mention all these things, right? Now, according to development, bones has been classified into membranous bone and cartilaginous bone. According to development, membranous bone and cartilaginous bone. Those bones which develop from cartilaginous model, as for example our tibia, femur, etc., that bone is called cartilaginous bone, and flat bones like parietal, occipital, etc., they develop from membrane. So, according to development, they are also divided into cartilaginous and membranous bone, right? Now, according to position means those bones which lies at the central axis, that is called axial skeleton, and rest is called appendicular skeleton. So within axial skeleton, what bones will come? Number one, bones of the skull, vertebra. There are 33 vertebrae, and also these ribs and sternum, ribs, vertebrae, and bones of the skull. They are from the axis of the body, so they are called axial skeleton, right? Total bone kota ache amader? How many bones? 206. Out of that, axial bones 80, and rest 126 appendicular skeleton. And appendicular skeleton is upper skeleton, upper extremity, lower extremity. These are appendicular skeleton. according to position, this division. And according to structure, I have already told, compact bone and spongy bone, according to structure. Now, let us talk about some points about periosteum. What is periosteum? I just told you periosteum is the outer covering of the bones. Now, if periosteum comes as a short note, what you write? Periosteum is cellular layer and it is vascular. Inner layer is vascular as well as cellular. What are the cells? That is the osteoblast, osteoclast. These cells are present in the deeper layer. This periosteum, what it does, after fracture of the bone, from this periosteum, new bone develops. This periosteum is supplied, apart from vessels, it is also supplied by, it has got rich nerve supply. So, suppose sometimes you may have to give traction to the bone. In case of fractured thigh bone, sometimes you have to give traction. That's why you have to drill the bone. As a house surgeon, if you are asked to drill the bone, so what will you do? First, as it is very, it is supplied by nerve, so it is sensitive. It will cause pain. So first of all, what you will do? First, anesthetize the periosteum. You take some anesthetic agent, local anesthetic agent, and will inject up to the periosteum. You will introduce your syringe till it reaches the bone, outer layer of the bone. That is the periosteum. There you will inject and it will be anesthetized. Then it will drill the bone. Right? So, and when muscle, you generally know, muscle generally becomes tendon and then it is attached to the bone. Actually, it is attached to the periosteum. Right? So, periosteum helps in new bone formation. It helps in new bone formation. Where there is no periosteum, there will be no bone formation. Right? Periosteum generally stops at the margin of the articular cartilage. Articular cartilage, what is that? When two bones actually forming joints, that joint you will see is covered by a hyaline cartilage. End of the long bone is covered by smooth hyaline cartilage. That is called articular cartilage. Just at the margin of the articular cartilage, it will stop. It will not cover the articular cartilage. So, if this articular cartilage, due to any reason, is damaged, then it will not regenerate. And this condition, we generally call it osteoarthritis. Osteoarthritis. You will find many aged patients suffering from osteoarthritis, very painful condition here, because there is no periosteum, so there will be no formation of the articular cartilage. This is called periosteum. Now come to the parts of a growing long bone. কি বলে অর্ণব ওই আগে ছুটে রাখো growing long bone. Here you see the parts of a growing long bone. Intervening portion I have already told you, this is diaphysis, and most extreme end, that is the epiphysis, and in between there is the epiphyseal cartilage. Right? Now the another this is called metaphysis. It is actually part of the diaphysis, but it is the epiphyseal end of the diaphysis. It is the epiphyseal end of diaphysis called metaphysis. It is very important from your examination point of view. Metaphysis and epiphysis also very important. Now come to the metaphysis. First of all, definition of metaphysis is, it is the epiphyseal end of the diaphysis. It is highly vascular. Highly vascular. It is the active growing end. It is the active growing end. Active the tendon of the muscle is attached to this region. Also, capsule of the joint is attached to this region. Suppose there is capsule. Suppose this is the one bone and another bone here. There is a fibrous covering of this joint. This fibrous covering is known as capsule of the joint. So this capsule of the joint, suppose this part is the metaphysis. So capsule is attached here. Sometimes muscles may be attached here. So this metaphyseal region is subjected to shearing force. If muscle contracts, there is some shearing force will be created. So there is some chance of injury here. Number 3, nutrient artery. I will discuss it later. Suppose this is the long bone. Generally this bone is supplied many arteries. One of the main arteries is the nutrient artery. That will end within the shaft and will go towards the end. This nutrient artery bend like this. This is called hairpin-like bend. Hairpin-like bend. Because of this hairpin-like bend, what will happen? And as it is most vascular, if there is any infective focus within your blood, that may be lodged here. It is, suppose from your tooth, infected tooth, some infected foci came to your blood or anywhere. Suppose you have developed some boil, some skin infection. From there, infection may come into the blood and that may be lost because here there is hairpin-like bend. So here the flow of the blood will be slow. So here there is a chance of lodgement of this infection. So it is most vulnerable for infection, right? If that part of the metaphysis within the capsule, suppose here this infection has occurred and it is lies within the capsule, so the whole joint may be involved in this infection. This infection may involve the whole joint, right? And infection of the bone, we generally call it osteomyelitis. This we call it osteomyelitis. And growing children, they are actually prone to develop this kind of osteomyelitis. If you are asked why, then you should say, because sir, it is highly vascular area and the nutrient vessels here form hairpin-like bend, so there is a chance of embedding or enlargement of the focus. That's why this area is vulnerable to infection, right? Within this area, some tumor develops. One of the tumor is known as chondrosarcoma. Another tumor is known as Osteosarcoma. They are actually sarcoma in malignant growth. We, in case of connective tissue, generally call it sarcoma. In case of epithelial or glandular tissue, we call it carcinoma. In general term, layman terms is cancer. So this is the bone cancer. Chondrosarcoma and osteosarcoma is this area prone to develop these two kinds of tumor, bone tumor. So these are the few lines of the Metaphysis. Now come to the epiphysis. If you see the young bone, developing bone, you will find its two ends is cartilaginous in nature. It has not yet been found bone. It is cartilaginous. This is called epiphyseal cartilage. Epiphyseal cartilage. Here you see epiphyseal cartilage, and just next to it, this epiphysis is also cartilage, and epiphyseal cartilage there is another cartilage. Right. Now, when it will become bone, then we should call it epiphyseal bone. All long bones, end of the all long bones, actually epiphyseal bone. Right. Now, this epiphysis, as it is becoming bone after birth, that is called, it is secondary, it develops from secondary ossification center. What is that? What is ossification? Ossification means when cartilage will become bone, from which area this bone formation will start. We generally call it center of ossification. What happens? Cartilage cell dies and it is replaced by bone cells, osteoblasts. That osteoblast will form bone. From that point, we call it center of ossification. Now, in case of diaphysis actually develops before birth. So, we generally call it develops from primary center of ossification. That means it develops before birth. Whenever I will call it primary, then you should think that it is before birth. Primary center of ossification. There is some exception, I will come to this later. And epiphysis generally develop after birth. It develops from secondary center of ossification. Right. Now, and this epiphyseal cartilage, actually it helps in the bone formation. So bone is becoming lengthening due to the epiphyseal cartilage. Now, at about puberty, this whole cartilage will be replaced by bone. That means the linear growth is stopped. When cartilage will become bone, that means your linear growth of the bone is stopped. Generally these things occurs in case of female 2 to 3 years earlier. 2 to 3 years earlier, their epiphysis becomes bone. And in case of male, 2 to 3 years later, it becomes bone. Right? Now, this is important when it will join with the bone. Suppose this is the diaphysis. Here there is epiphysis. It is epiphysis. Now, these two epiphyses will not unite with the shaft simultaneously. One will unite earlier and other unite later. Which will unite later, that end we generally call it Why are you yawning? That means you can't understand. Which end will join later, that end we call growing end. Growing end. Now you have to know which end is the growing end. So there is a dictum. I will show you this picture. Which end is growing end? And which another thing. Have you seen sometimes crossing of the train? Have you seen? What happened? जब क्रॉसिंग होता है कौन ट्रेन पहले जाता है? पहले जाता है वो जाता है ना, लेफ्ट में जाता है वो आगे जाता है. क्रॉसिंग में देखा? ट्रेन क्रॉसिंग को भी देखा इसमें स्टेशन में? The which train will come fast will go last. Right? You should remember this. Which epiphysis will appear fast, will unite last. ये याद रखना है. Which epiphysis appears fast, unite last. Unite last means that end is the growing end. Now how to identify which end of the bone is growing end? এখানে একটা এরকম ছবি আসছে, একটা বাচ্চার ছবি আছে, দেখো পাঠিয়েছি. When nutrient artery will enter, suppose this is the direction of the nutrient artery. So generally growing end will be opposite the direction of the nutrient artery. So if you can identify the direction of the nutrient artery, you can say which end is the growing end. Suppose this is the direction of the nutrient artery, this end will be the growing end. Now here you see, it is the milking position. Someone is milking. তোর বাচ্চাটা মিল্ক করে. To elbow I go, from knee I flee. To elbow I go, from knee I flee. This is the direction of the nutrient artery. This is the direction of the nutrient artery. So which end will be the growing end in case of here? This end will be growing end. তাহলে আমাদের wrist, this जो bones है, that will be the growing end. And here humerus upper end is the growing end. Right? Here you see, this is the direction of the nutrient artery. So lower end of the femur is the growing end. Here you see, upper end of the tibia is the growing end. Why you should know this? Why you should know this? Suppose one baby came to you with a tumor near the knee joint. So you know the knee joint is a growing end. If you do not treat it properly, if this is damaged, if its metaphysis is damaged, then there will be shunting of the growth. Growth will be shunted, and that leg will be shorter as compared to the other. Right? So that's why you should know which end is the growing end, and this is the dictum. Right? Now tell me some functions of the skeleton. What is the function of a skeleton? Now you tell me the function. हमारे skeleton का function है. Skeleton has come from skeletos. Dried body. Skeletos means dried body. Osteology. Osteology come from osteon. Osteon means bone. The subject which deals with bones, that is called osteology. Now skeleton, what is the function of the skeleton? Number one function, it supports the body weight. Our body weight is supported by the lower limb, and it helps in movement, in grasping, in movement, right? And it protects. एक करें बोले एक. Protects. What it protects? Skull bone protects brain. Here ribs and sternum, vertebra protects heart, lung. right? So it's protective in function. It is the storehouse of minerals, storehouse of minerals, storehouse of calcium, phosphorus, storehouse of fat. Within the medullary cavity of a long bone, there is a cavity that is called medullary cavity. Within it, you will get yellow marrow, red marrow. In young bone, you will get red marrow. As age will advance, that will be converted into yellow marrow, right? And from the red bone marrow, what happens? Hemopoiesis, formation of RBC, formation of WBC, formation of platelet. So the hemopoietic function, where this red bone marrow is found in which bone? Generally, end of the long bones, ribs, sternum. Then this bone is the hip bone, right? Sometimes you may have to aspirate bone marrow. Suppose you are a house surgeon, you are asked by your consulting surgeon, asked you to draw some bone marrow and send it to pathology, where you will puncture. So you should know from where this red bone is found. Number one is sternum. Sternum is the site of bone marrow puncture. It is found in the iliac crest. So anterior superior spine, posterior superior spine, you may puncture. Upper end of the bones, suppose this is the upper end of the tibia, there also you can get bone marrow, right? So these are the sites of the bone marrow. Talked about some exception. Secondary center of ossification generally develops after birth. One important exception is lower end of the femur and upper end of the tibia. These two secondary center of ossification, actually it develops before birth, after birth, not after birth. It is exception. Another exception is primary center of ossification, which develops after birth, is carpal bones, tarsal bones. Right, they are exception. So, this in short, today's class. Now what you knew, new things. You knew the classification of bones according to shape, according to structure, according to development. According to development means whether it is developed from cartilage or whether it is developed from membrane, membranous bone, cartilaginous bone. Now, according to structure, whether it is compact bone or spongy bone, right? According to shape, long, short, irregular, pneumatic, etc. You knew about the functions of the bone. You knew epiphysis. What is epiphysis? What is diaphysis? What is metaphysis? Why they are important? Right. So these are in short today's class.